So thank you for joining us here at the Nashua Public Library to have a conversation on COVID-19. My name is Bobby Bagley. I'm the Director of the Division of Public Health and Community Services, and I'm here with Angela Constantino, who is our epidemiologist. We're glad that you're here with us, and we want this to be informative, and also we want to take questions that you have as we go through our presentation. As you know, we have a very evolving event happening in our country as well as in our state with COVID-19. Angela is going to go through some information that talks about the epidemiology of COVID-19, and then I'm going to talk about what our public health response is in the city of Nashua and in the greater Nashua region. Angela?
Okay. So just some background. Novel coronavirus COVID-19 is a novel coronavirus which causes the disease COVID-19. Coronaviruses in general are a large family of viruses that can cause illness ranging from the common cold to more severe respiratory illness. Novel coronaviruses are viruses that have jumped the animal-human species barrier. And we first saw this novel coronavirus, COVID-19, in December of 2019 in Wuhan, China. January 20th was the first case in the United States, and March 2nd was the first case in New Hampshire. So just a case update. So as of today, March 13th, there have been more than 137,000 cases worldwide and about 5,000 deaths. And as of last week, we started to see the dip in cases inside of China and the increase in cases outside of China. And then moving to the United States, right now we have about 1,600 cases, 41 total deaths, and there's 47 states reporting cases. Of those cases, 138 are travel-related, 129 are close contacts, and there are currently 1,300 people under investigation, which means that they may have had some sort of exposure at some point, and now they're being monitored by public health officials. So New Hampshire cases. So we have 6 cases right now in New Hampshire. 2 of those have been confirmed by the CDC lab. 4 are presumptive positives, which means they have not yet received confirmation by the CDC lab. 3 of those are in Grafton County, and 3 of those are in Rockingham County. 3 of those are travel-related, and 3 of those are direct contacts to a case, which means that right now in New Hampshire, we do not have community-based transmission. There are also 21 tests pending in the state lab. And there are 273 persons being monitored at this time. So just to review the epidemiology, so COVID-19 has a case fatality rate of 1.4 to 1.7%, which means that about 1.4% of people will die due to coronavirus, or 1.4% of the people that contact the virus will die. And this is higher in the elderly population and people who are experiencing underlying medical conditions. This is compared to a seasonal influenza case fatality rate of 0.1%, compared to H1N1, 0.4%. SARS had a 10% case fatality rate, and MERS had a 35% case fatality rate. We also use the reproductive number to determine infectivity of a virus. So novel coronavirus has a reproductive number of between 2 and 3, so 2.5, which means that on average, 1 case of COVID-19 will infect 2.5 individuals given no containment measures. This is compared to a measles reproductive number of 12, so that's a lot more infectious, and seasonal influenza of 1.5, so less so more infectious than seasonal influenza. And there is an incubation period of 0 to 14 days, which means that from the time of exposure, an individual has 14 days to develop signs or symptoms. After that 14 days, they would be considered not at risk of developing COVID-19. On average, we see about 5 to 6 days for symptom development.
So I'm going to talk about our public health response. But before I talk about the public health response, are there any questions for Angela with regards to what you saw with the epidemiology of this disease? And so what we're looking at is a disease that is serious, especially within particular population groups. So in our population groups, based on what we've seen happening across the globe in the countries that have the highest numbers, individuals that were 60 years of age or older that had comorbidity or other health conditions such as heart disease, chronic obstructive pulmonary disorder, diabetes, asthma, individuals that have other comorbidity or underlying health conditions are impacted by this disease at a greater rate than other parts of our population. And some people may end up coming into contact with this virus and it not be very serious for them, but for our population 60 years of age and older and folks with comorbidities, this is a little bit more of a serious health disease that we want to make sure that we can avoid. So as far as our public health response at the local level, we activated our multi-agency collaborating entity, which is what we call a MACE, and we did this in during the week of February, on February 27th. And we opened our MACE so that we could begin monitoring and on a daily basis within our division, coming together with our epidemiologists, our health promotion and communications specialists, our health officer, and other staff at their division, so that we could keep a close eye on what's going on and meeting with our state partners as well. A big part of that MACE activation is so that we could maintain information management, so that we can make sure that we're providing a clear and consistent communication message to our community and to our partners. It is very important for the information that comes out to be consistent as we keep people up to date on what's happening. At this point, because as Angela showed in one of the previous slides, the number of cases have gone up in the U.S. In New Hampshire, we now have 6 cases. We're looking at what countermeasures we need to put in place and mitigation as well. So initially we start out with containment. You're trying to stop the spread of this infection by putting certain measures in place. We're at the point now where we're also looking at mitigation. What that means is that there's contact investigation that occurs when a person is identified as a confirmed case. So out of the 6 cases that we now have, 2 have been confirmed through CDC laboratory testing. The other 4, to our knowledge at this point in time, are still what we call presumptive positives. And so until we get that confirmation from the CDC, we're treating those cases as if they are positive cases. So the activity that goes with that by our state response from public health side is that individuals that are in contact with those folks have been identified and have been asked to quarantine themselves for 14 days. There's active monitoring of people who are under investigation. That PUI are those people that are under investigation, which would include the individuals that have been identified as positive as well as their contacts. There are also individuals that may be considered in that category that may have traveled to some parts of the world or other places where they may have been exposed to COVID-19, and those folks are also asked to quarantine themselves and self-monitor. We're working very closely with our hospitals and our healthcare facilities, again, as a part of our countermeasures and as a part of the mitigation that we have begun to move in here in the greater Nashua area. In our coordination with the hospitals, we're meeting on a weekly basis. One of the things that we want to make sure is that our workforce is protected. So we want to make sure that we have enough personal protective equipment available to our healthcare staff and to our first responders in the city of Nashua. That PPE is that personal protective equipment. And we also want to make sure that we're monitoring for a med surge if in case that does happen. Our Greater Nashua Public Health Network and our nurses are ready to vaccinate when a vaccine is available. And so right now they're working on it. It takes a while before vaccines can come through to the point of where they can be used effectively in our population. Once they are available, our public health nurses will be vaccinating individuals to protect them against COVID-19. This slide shows a travel advisory. There's a lot of information that's coming out from the CDC. We have a great deal of information on our website as well that has links to both the CDC information, our Department of Health and Human Services information at www.nashuanh.gov. And if you click on the Division of Public Health and Community Services, you'll see all the information on our website there. And you can click on highlighted areas in some of the information, and it will connect you to those resources. This slide actually shows the areas where you see the most amount of widespread contained ongoing transmission, where there has been restrictions to entry into the United States. There's also, so the darker blue is where you see that, and then there's another shade of blue over where you can see Italy, and this looks a little bit dark. It all kind of looks like it blends in there together. Where there's sustained ongoing transmission, and in some of the lighter blue parts, there's also sustained ongoing transmission as well. If you go to one of the links that we have on our website, Johns Hopkins University has an interactive map. That first map that Angela showed that had the red bubbles on it and had the list of the countries and the number of cases in each of those countries. Johns Hopkins is updated on a regular basis, so you can click on there and 2 hours later, those numbers will be updated. That is a good map to use so that you can see how things are evolving across the globe, as well as the intensity of what's happening around the world and even in the United States. The clinical features of COVID-19 are really important to understand. So the mode of transmission, how is this virus being spread, is really important to know. Person to person right now is what we're seeing. Spread by droplets, aerosol, and by fomites. So droplets, we spread droplets just when we talk. When we sing, when we laugh, you can see droplets sort of spewing out of individuals' mouths. That's how this is spread. Fomites are objects, so we love our gadgets and we love things like this. I touch this. Anything that I have on my hands is now on my phone. If I share my phone with Angela, whatever was on my phone, I've now shared that with her. And so we know that COVID-19, this virus can be spread in those different ways and aerosolized in the air by a number of different methods as well. Symptoms of this disease, the most common are fever, dry cough, shortness of breath, and myalgia. So a fever, a temp of 100.8 is one of concern. The dry cough, the shortness of breath, these are symptoms that can be seen in individuals that are affected by COVID-19, and myalgia is muscle aches. Some of these same symptoms are symptoms that we see with influenza, right? And so we want to make sure that there are certain questions that are asked to really determine whether or not a person has been exposed to COVID-19. Have they traveled? Have they been in contact with anyone who's traveled to any one of these countries that have been identified as having high community transmission? Have they been exposed to someone who's been diagnosed as a positive? And are these individuals exhibiting symptoms based on those criteria? Those folks will then be tested because we want to rule out COVID-19, but they may also receive other testing. They may also receive flu testing if they haven't had that done and if they haven't had a flu vaccine, because we need to rule some of those things as well. There are also other cold viruses that are out right now that are not COVID-19. We're also moving into allergy season, so you're going to see a lot of different things exhibited in individuals. What we want is for people, if they have symptoms and those symptoms worsen, they need to make sure that they call their medical provider so that they can get some further recommendations and instructions on what needs to happen. Less common Symptoms include sputum production, so an increased amount of saliva production or stuff that you're coughing up, headache, and even GI symptoms. Some of the science shows that this COVID virus can be spread in the stool. About 50% of the individuals that have been impacted by COVID-19 are also shedding the virus in their stool, and that's a really important feature as well to understand that hand washing is really important to help prevent that spread. As far as testing and treatment, there are no specific treatment recommendations currently for infection with COVID-19. They are looking at some antivirals that might help relieve some of the symptoms, and there are other recommendations for treating some of the other symptoms. So if you have a fever, you may be told to take Tylenol, but their provider, the healthcare provider, is going to give recommendations for what these individuals may need to do. People infected with COVID-19 may need to have supportive care to help relieve the symptoms, drinking plenty of fluids, staying at home, and resting. And we cannot emphasize that enough. If people are exhibiting respiratory illness, symptoms that are related to respiratory illness, fever, cough, diarrhea, people need to stay at home if they're sick. That will also help us prevent the spread of this viral infection in our community. Patients who are very sick may need to go to the hospital to get care, but what we need for those individuals to do is call their healthcare provider before they go to their office. When they call their healthcare provider's office, they will be asked certain questions about their symptoms, about their travel, about their contact with an individual with COVID-19. And then once those questions are answered, then that person may be directed to have testing done if that provider deems necessary. We don't want people just showing up at hospitals or their doctor's offices or even to the emergency room without calling prior and providing that specific information. As we said before, they're working on the vaccine, and there's some antiviral trials that are currently underway right now, but that's going to be somewhere within months before those vaccines are available for them to even go through trials and then go through trials with humans to actually be used. Testing right now is available at our state lab, and the testing yields a presumptive positive, which then means that that test will then be sent to the CDC for a final confirmation. If people are experiencing symptoms, again, can't stress it enough, people need to call their healthcare provider and make sure that they speak with them before they go to their office or before they go to the emergency room. Can't emphasize this enough. If people are sick with those cold symptoms, with fever or diarrhea, they really need to stay at home. And while they're at home, they also want to make sure that they protect the rest of their family members from coming into contact with this viral infection. In order to prevent the spread of this infection, we're asking people to do a number of things. And we would ask this in public health during influenza season, for any other viral infection. There are certain things that we want you to do. If you have a cough or a sneeze, we want you to cough in your arm. If you have a sneeze, do the same thing so that you're covering that cough so that you're not spraying out the droplets that then can be in the air for other people to come in contact with. We're asking people to also maintain some social distancing, right? So for right now, we want people, because we are trying to contain this, stay at least 6 feet away from the people that you're interacting with. Social distancing will help, again, prevent the spread of aerosolized droplets flowing through the air. We also want to make sure that people wash their hands often. We do a lot of touching with our hands, and if you watch and pay attention to people throughout the course of the day, you'll see all kinds of things happening with our hands. We touch our eyes, we touch our noses, we touch our mouths. Then we touch things, and then we touch our eyes, we touch our noses, and we touch our mouths. We want people to be very observant of their personal behaviors, and then also making sure people wash their hands as often as they can. Using soap and water is really important and is the best way to get things off of our hands. At least 20 seconds, sing happy birthday to you, happy birthday to you, until you get to that first few stanzas of that, but at least 20 seconds. You'd be surprised that when we go and wash our hands really quickly, that we're really not taking all of the germs or the dirt off of our hands. There's something that's called a germ glow kit that can be used, and we've actually had folks do this where they go in, they wash their hands, you put the little gel on, put that under the blue light, and you can still see all the stuff on their hands. So we don't really have a habit of doing really good hand washing, and we're asking people to start putting that into practice right now. If you can't get to running water, soap and water is the best. If you can't get to running water, we're asking people to use Purell. When you use the Purell, you're going to use it the same way you would have been using the soap and water. You're going to wash almost your hands with the Purell. It's alcohol-based, it'll dry. Hand washing with soap and water is actually better, but if that's what you have, that's what you use. Already said this about washing the hands often, not touching your eyes, your nose, or your mouth with unwashed hands, avoiding close contact with people who are sick. This is where that social distancing comes in, covering your cough and your sneeze, and then also wiping down surfaces. So just as my phone is on this surface and then my hands are on my phone, areas where in common areas where there's a lot of physical contact and people putting their hands down on things, those areas need to be wiped down. There are disinfectants that are very effective against killing this virus as well as other viral things on surfaces. You want to make sure that you use those materials or those solutions the way that the manufacturer says to use those. And then when you wipe down those surfaces, you want to let those surfaces air dry. Emphasis on if you are sick, please, please, please stay at home. One of our major goals in public health is to create a general awareness of this, again, the seriousness or the severity of COVID-19. Younger people that are exposed to this virus may not become as ill as those that may have underlying health conditions or some of our population that's 65 and older. So we want everybody to practice good personal hygiene to prevent this respiratory illness and to prevent the spread of it. One of the things that we've been seeing, and many of you have probably seen this, as the news is pushing out information, and when COVID-19 was first being promoted to be aware of it, you saw people in masks all over the streets in places. We're asking people not to wear masks. You really don't need to wear a mask if you're not sick. If you go into a healthcare facility after calling your healthcare provider and they say, go to the emergency room or come to my office and I'm going to do a culture on you or take a sample, that's when they'll have you put on a mask, because then you're not exposing other people that are in that facility to the virus that you could be carrying. We don't want people in the community wearing masks. 2 reasons why you don't need it. And the other reason why is that it's going to give people a false sense of security that they have their mask on, that they don't have to do any other things. And we really want people to focus on washing their hands to get germs off of their hands so they're not continually spreading it from person to person or on objects. We also want people to really be sensitive about individuals who can be prejudiced against because of their fear of the virus. Initially, because COVID-19 started out in Wuhan, China, there was some discrimination towards Asian populations that weren't even in China, that were living in other places. But because the disease started out there, people were being discriminated against because they were of Asian descent. Well, right now, there's lots of different population groups that are being affected by this. We don't want anyone to be prejudiced or treated in a prejudiced manner because of this virus or because of fear of the virus. And we also don't want people to assume that individuals of Asian descent are more likely to have COVID-19 when this is a disease that does not discriminate against any race or ethnic group or any age. The messaging that we've been putting out from the health department, we're doing that on a weekly basis. We're updating a message that goes out. We have information on our website that we keep updated as we get information from either the CDC or from our state health department. We're updating that information. We want people to be informed. We want people to be informed because when people are informed and they're educated, they can make better decisions about their situation, and they can plan and they can be prepared. We have a COVID-19 fact sheet on our website that's in both English and in Spanish. Right now, we're doing weekly calls with the hospitals, with our health department, with police, with fire, with our American medical response, the mayor's office. We have making sure that we connect with the schools. We're making sure that we, again, are able to share information that's consistent and that will help keep the public informed. I mentioned our city website and social media. We're using Twitter, we're using Facebook, YouTube. So we're pushing out lots of information, again, so that we can have our community as educated as possible. We do a weekly radio show on WSMN 1590 radio, and we're pushing out information and updates on there on a weekly basis. We're usually there Fridays from 10 to 11. We are pushing things out on Access TV, and we're also making sure that we connect with our newspaper, the Telegraph, the union leader, whoever calls us, so that we can push out information about what we're doing, our countermeasures, and the steps that we're taking for mitigation. We are also doing sector-specific communication. For instance, today I had an opportunity to meet with our faith-based community. We are working together to make sure that information is consistent and that we could find out what our community partners and our stakeholders can do as we move ahead to address this situation. This is a copy of the fact sheet that we have on our website, and it's already been updated. The paragraph that's underneath the fever, cough, and difficulty breathing changed once those countries that were listed and the disease started to spread in other areas across Europe and other countries. So we had to update this information as well. So you'll see that we're trying to make sure that we can stay on top of correct information and communicate that to the public. If you want any of these materials, again, there's a link on our website. You can download this. We want people to share it, put it up at your organization, again, so that everybody has the same information. For sector-specific guidelines, there are links on our website for the schools, for businesses, for long-term care facilities, and the CDC has put out specific guidelines for faith-based community leaders as well. And as more information comes out, more information will be added to our website. For resources, again, this is all listed. You can contact us at the Nashua Health Department. You can call 589-4560. You can call 589-4500 for our Community Health Department, and someone will make sure that your call gets sent to the right department and the right person to address any questions that you may have. We're also listing information that we receive from the CDC as well, because that is a very reliable source of information, as well as our Department of Health and Human Services. We have the frequently asked questions sheet on our website, and we also make sure that we put out, as the Department of Health and Human Services puts out press releases, we put that information out as well, and any health alert information, we put that out. And as I mentioned before, we have the link for the Johns Hopkins global case link that shows you what's happening around the world. At this time, we'd like to take questions, and please feel free to ask whatever questions are of concern for you. This is being recorded, and so your question may be a question that someone who watches this recording, and it'll give that person the opportunity to have their question answered. Okay. Do you want to take the questions? I'll be Oprah. Yeah, ready?
Okay, my name is Andrea Hanley. I'm with Telegraph. Do you think that the virus has taken away public attention from any other health concerns that's going on right now?
So I think that public health emergencies tend to come into the front when we're dealing with them. So other things are not forgotten, but public health emergencies do have a tendency to take the forefront. So I don't think we've forgotten about anything, but I think that our priority right now is containment and mitigation of this virus.
Cool.
So I can add to that as well?
Yeah.
So we do have, COVID-19 is one thing that's come, to the forefront, but we're still doing work around lead case management, asthma case management. We still have our team at our environmental health department doing their food service inspections. And so we still have to continue our ongoing work to protect the community because there's other things that can happen as well. We're still doing our STD clinics, our immunization clinics. And so there's a lot of work that's still being done with also that added emphasis on making sure that we can contain and mitigate COVID-19 spread. So a lot of folks are very, very busy.
Okay, cool. Thank you. What do you think about people who believe that the media has blown COVID-19 out of proportion?
So I think that this is a serious illness. I think that we all need to take it seriously. I think that the measures that we're taking right now as a city and as a public health department are appropriate for the level of concern that we have right now. Right now, there is not community-based transmission in New Hampshire, as we know, so we are still fairly low risk right now. But yeah, Bobby, do you have anything to respond to that?
So I think the media finds its place, in a position of wanting to help keep our community and our society informed. I think what we want is, with the media to make sure that the information that comes out is accurate and that it's consistent. We have no control over that. As much as we can, we try to push out information that is accurate, based on reliable sources from the CDC. And so I think as long as that's what's happening and that's the goal of the media, to work together with public health and the messaging, I think that's important. As far as blowing it out of proportion, I mean, it's a new infection. It's a new disease. And when there's new things, there's novelty that comes along with it. There's a lot of energy that's put around following it. We can see that things are changing on a daily basis, and so that's what makes the news. There are other things that are going on right now. It's not glamorous or as big as this is right now, but right now it's what it is, and we're glad that information is being pushed out to our community. We just want to make sure that the media is consistent with the messaging that we need to come out from our public health officials.
Yeah, I totally agree. Is it okay that I keep going? You guys cool with that? Okay. How do you think the United States response is compared to other countries' response in taking action? And is there anything more that we could be doing right now? And locally as well.
Bobby, do you want to take that?
So I think from a public health perspective, I'm a very proactive person in public health. We're data-driven, which means that we like to see the numbers. We've had the opportunity, because we knew about this since January, that there are some measures that we probably could have started to do more planning around addressing, especially as we saw exponentially how things were happening across the globe, that we could have taken some measures sooner with regards to planning. At our health department in Nashua, because again, we have the public health radio hour, we're always talking about being prepared. We're always telling people to make sure that they have their preparedness kits available. We have a whole Go Prep campaign that we were pushing for folks. When you're talking about those things and there's nothing going on, it doesn't really, there's no incentive to do anything at that point in time, but we've been pushing that messaging out. We want people to be prepared and not scared, and so we've had that sort of tagline in our messaging during Emergency Preparedness Month. I think that we could have responded sooner with looking at, we had we're in March now and it started in January, so we're 3 months down. There could have been some things that could have been started sooner as far as making sure that we were going to have enough test kits, We've seen in other countries where they are doing more testing in their communities. And I think, again, that was because of the because of the numbers and because of the data that they made they made those tests accessible to folks. We need to do the same thing here.
Mhm.
Anything else, Angela?
No, that's a good answer.
Yeah, that's about it from me. Thank you, though.
Thank you. Does anyone else have any questions? Do you have questions?
Of the of the patients who have been tested positive in New Hampshire, has it been determined if they ever received a common flu inoculation?
So that information on those 6 individuals, we don't have that. For those folks the positive cases? Is that what your question was about, the positive cases that have been identified?
Yes.
So we don't have that information. So when our state does, a disease is reported in a particular region, there's particular public health nurses that will investigate those cases, and they will have a lot more information. When they share information with us, it's the most high-level pertinent information that we need to know. So they probably have that information on those 6 individuals on whether or not they were vaccinated for flu or not. I'm not aware or have that information. I'm not sure, Angela, if you do. But it probably, sir, would have been ruled out. So they would have asked them to make sure that they did not have the flu when they tested them.
No further questions.
Okay, thank you. Any questions in the back? Okay. All right. So that concludes our informational session on COVID-19. We hope that that information that we provided here is helpful. And if people have questions, feel free. Again, this is recorded, so please feel free to call us at the Health Department at 589-4560 or 589-4500. You can also post questions to us on our Facebook page, and we will make sure that we have someone respond to those questions. And I think we're also going to have different sessions set up for Ask Me Anything.
Yep, like today we had an Ask Me Anything session on the New Hampshire Civic Sounding Board Facebook page. So we're going to continue those sessions. We might do another one in the Nashua Civic Sounding Board, and then we're also going to open it up to other cities and towns in the region to go on their city pages and do the Ask Me Anything sessions.
And folks can also contact our Department of Health and Human Services. There is a call line that you can call through 211, or you can call the public health nurses at 271-4496. Thank you for coming, and thank you for listening.
Thank you.